Let's jump right into this explainer and look at the actual, hard, clinical evidence behind the ingredients in CYSTUROL. You know, if you've been dealing with chronic pelvic discomfort, you've probably noticed the internet is just completely flooded with generic advice and, well, quick fixes. But today, we're doing something a little different. We're skipping the generic fluff and we are going to break down the peer-reviewed science, literally, ingredient by ingredient. We really want to understand exactly how a targeted, evidence-based approach can actually tackle some of the absolute most frustrating bladder symptoms out there.
Okay, so here is a bit of a contrarian truth, and it totally challenges what so many women are told by their doctors, their friends, even the media. Picture this. You go to the clinic with that awful burning, the urgency, the pelvic pain. You're handed a prescription for antibiotics, right? But then, just a few weeks later, boom, the symptoms are right back. It's so easy to feel like you just have terrible luck or like you're doing something wrong. But the truth, and this is backed by emerging urological research, is that if you're trapped in what feels like an endless cycle of recurring UTIs, your UTI probably isn't a UTI at all.
Instead, it's often interstitial cystitis or bladder pain syndrome. We usually just call it IC/BPS. And honestly, this completely explains why those traditional antibiotics just consistently fail to give you any relief. I mean, antibiotics kill bacteria, right? But with IC/BPS, there's literally no bacterial infection to fight. It's actually a chronic condition. We're talking urinary urgency, frequency, nocturia, which, is waking up multiple times a night to pee, and this intense pain that feels like it's coming straight from the bladder itself. If you've had these symptoms for over 6 weeks without a clear cause like an infection, you are very likely looking at IC/BPS.
So, the absolute most crucial takeaway here is that you are not alone in this. Not even close. According to the RAND Interstitial Cystitis Epidemiology Study, somewhere between 3 to 8 million adult women in the U.S. alone have symptoms consistent with IC/BPS. To put that into perspective, that's like the entire population of several U.S. states combined, just suffering in silence. And hey, it's not just women either. A follow-up study actually estimated that around 2 to 4% of U.S. men also have these symptoms, though for men it frequently gets overlooked because the symptoms heavily overlap with chronic prostatitis.
Man, I know it can be just incredibly frustrating to chase symptom relief for years before finally getting a proper diagnosis. Because these symptoms mimic so many other common issues, the diagnostic delays for IC/BPS frequently stretch beyond 4 incredibly painful years. Just imagine that, 4 whole years of being told you just have a stubborn UTI, or even worse, being told it's all in your head. And this is exactly why understanding the science of your own body is so empowering. When you finally know what's actually happening in your bladder, you can start looking for the right kind of targeted support.
Right, so let's move straight into the ingredient profile and see how CYSTUROL actually builds a targeted defense. Because the approach here isn't just to, throw a bunch of trending botanicals into a capsule and hope for the best. It's about utilizing active ingredients that have been specifically studied for the populations dealing with these exact pelvic and bladder issues. We're looking at 6 specific ingredients, and each one plays a really distinct, scientifically validated role.
We absolutely have to start with the anchor of the whole formula, and that is quercetin. So quercetin is a plant bioflavonoid. You actually find it naturally in everyday foods like onions, apples, and capers. But in the clinical world, it is the most studied ingredient in the CYSTUROL formula, and it's the one with the absolute strongest direct evidence for IC/BPS. Researchers have actually been studying this specific flavonoid for over 2 decades, looking exactly at how it impacts urologic chronic pelvic pain syndromes.
To really understand why it's the anchor, we need to look back at a foundational 2001 open-label pilot study. Researchers took 22 adults who had classically documented interstitial cystitis, and they gave them 500 milligrams of a quercetin-based supplement twice a day for 4 weeks. And the results? Honestly, they were remarkable. Not only did it significantly improve pelvic pain, but the study also reported massive improvements in both urinary urgency and frequency. It was really well tolerated and basically provided the first major published clinical signal that quercetin could be a total game changer for IC/BPS.
And this comparison brilliantly illustrates why it works so well. See, a major driver of IC/BPS symptoms is the activation of mast cells in your bladder. Those cells release inflammatory mediators, and that is what causes that awful burning pain. Well, a 2012 study published in PLOS One demonstrated something wild. Quercetin is actually more effective than cromolyn. Now, cromolyn is a pharmaceutical mast cell stabilizer that's often used off-label for IC. But quercetin was better at blocking that inflammatory release from human mast cells. It's actively modulating those inflammatory signaling pathways right at the source.
But okay, there is a massive catch with quercetin. On its own, it has notoriously low oral bioavailability. Now, that's just a fancy scientific way of saying that if you just swallow a pure quercetin capsule, your body is really going to struggle to absorb it. A lot of that active ingredient is just going to pass right through you, totally unused. So if you're actually going to use quercetin effectively, you have to engineer a clever way to help the body take it in. To solve this exact problem, the formula utilizes enzyme synergy. It's this brilliant scientific mechanism that leading urologists have been documenting as far back as 2003. So here's how it works. Step 1. You ingest the quercetin alongside bromelain and papain. Step 2. These proteoleic, meaning protein-digesting enzymes, which come from pineapple stems and papaya, get straight to work. Fun fact, by the way, these are the exact same types of enzymes that make pineapple such a great natural meat tenderizer. But here, they act as the key to dramatically increasing the absorption of quercetin into your system. Plus, bromelain and papain bring their own well-documented anti-inflammatory and tissue comfort properties to the table, which makes this whole trio incredibly effective.
Okay, moving beyond just the inflammation, let's look at how the formula addresses the secondary symptoms of IC/BPS. Because look, anyone with this condition knows exactly how hypersensitive their system becomes to acidic triggers. When your bladder lining is compromised, everyday things like citrus, tomatoes, artificial sweeteners, or especially standard acidic vitamins, they can just send you into a massive, painful flare. Formulating for this specific community means you have to be hyper-aware of keeping the end product completely non-acidic and super gentle. Cranberry is a perfect example of this delicate balance. We know from massive systematic reviews that cranberry is absolutely fantastic for preventing E. coli from sticking to the bladder wall. But on the flip side, highly acidic cranberry juice is a notorious trigger that the IC community avoids like the plague, which is exactly why CYSTUROL strictly uses non-acidic whole fruit powder inside their vegan capsules. That way, you get those A-type proanthocyanidins that support general urinary tract health, but without dumping a massive, painful acid load onto a bladder that's already inflamed. Furthermore, dealing with chronic bladder pain literally wrecks your nervous system. Living with that constant urgency and pain just creates this vicious cycle of central sensitization and pelvic floor tension. So to combat that cycle, the formula layers in some very specific calming botanicals. You have passion flower herb, which has actually been clinically studied for reducing pre-procedure anxiety without messing with your motor functions. And that is paired seamlessly with wood betony leaf, a classic Western herb used for centuries to ease nervous tension. Together, they really target that stress axis dimension of living with chronic pelvic pain.
And man, we cannot talk about chronic bladder issues without talking about the pure exhaustion. Nighttime urinary frequency, waking up 3, 4, 5 times a night, it just destroys your sleep cycle. That is exactly why valerian root is included here. Valerian contains valerianic acid, which acts as a GABA-A receptor modulator. It's a scientifically backed mechanism that gently supports subjective sleep quality and smooth muscle relaxation. Because reclaiming that vital rest, it's absolutely critical for allowing your body to heal and actually cope with the condition.
Now, taking a step back, it is incredibly important to note that CYSTUROL is an evidence-based dietary supplement. It's not a cure for your condition, and it definitely does not replace professional medical care. Because IC/BPS presents so differently in every single person, there's just no single magic pill. The modern clinical consensus is that treating chronic pelvic pain requires looking at the whole big picture. We're talking your diet, your nervous system, your pelvic floor, and your bladder tissue. In fact, back in 2022, the American Urological Association actually updated their guidelines to explicitly recommend this exact kind of multimodal approach. They completely moved away from a strict step-by-step treatment ladder. What this means is that evidence-based oral supplements containing quercetin and targeted botanicals are actually designed to work perfectly alongside behavioral strategies, like your low-acid diet and hydration management, as well as the medical care, physical therapy, and procedures directed by your urologist. It's a team effort.
So, knowing what you now know about mast cell activation, the critical importance of enzyme synergy for absorption, and how calming botanicals can actually help break the cycle of nervous system tension, what steps will you take today? How will you use this science to build a comprehensive, truly individualized care plan alongside your doctor that finally breaks the cycle of pain? The research is out there, now it's in your hands. Thanks so much for watching this explainer.